Assalamualaikum everyone, welcome back to this channel. This is me Alia Wahid, and in this video we are going to discuss about cholinergic antagonist drugs. So in the previous lecture we have studied that what are cholinergic antagonists and where they affect. We have discussed about all these things, and I have also draw a diagram in order to make your complete concept to you. But now we are going to start the drugs which are acting as a cholinergic antagonist. So the first and the main drug which is acting as a cholinergic antagonist is our atropine. And there are some more drugs, and we will discuss all of them. So first of all, let's discuss that what is the source of atropine. So atropine source is a plant which is Bellonda, uh, Atropa belladonna. Atropa belladonna. So actually atropine is a plant alkaloid. So it's mean in Atropa belladonna atropine is a alkaloid. So it is alkaloid in nature. Okay, यहाँ पर L भी आता है, ठीक है. तो इसकी नेचर मैंने आपको बता दी है. Then on what kind of receptor it is going to be attached. So इसका receptor पे क्या action है. So it is going to attach on both muscarinic receptor as well as on nicotinic receptor, acting and affecting both as internally as well as peripherally. And what is the duration of this drug? So its duration is about 4 hours. So it will acting till the 4 hours in our body. Then in what kind of atropine drug is. So now we are going to discuss about the nature of this drug. So it is a tertiary amide. What is mean by tertiary amide? So tertiary amide mean that it can enter our blood brain barrier and has polar in nature. And the second, its nature indicates that it is a competitive inhibitor of acetylcholine, and you can say it is an inhibitor of cholinergic reaction. So it is what it is inhibit acetylcholine. So it doesn't allow acetylcholine to bind on muscarinic as well as on the nicotinic receptors, and it will bind itself with these receptors and perform specific type of actions. Now let's discuss what are the actions which are performed by atropine drug. So the actions of these drugs are here. So its action are similar to the sympathetic nervous system action. So in the sympathetic nervous system, you are in the fight and the flight mode. Mean you are in the mode of fighting with each other. So whenever you are in the fighting mode, your heart rate increase, your blood pressure increase, your pupil of the eye dilates, and therefore your eyes become open. Your gastrointestinal tract will decrease its motility and decrease its secretion. Your urination is completely blocked out, and these kind of some are actions done when you are in a flight mode or fight and flight mode. Now let's discuss its section. So first section is on eye. So eye pupil dilates. So there is a dilation of eye pupil. So the dilation of eye pupil can also be called as mydrosis. Mydrosis. Okay, so it is causing mydrosis of the eye. Second, its effect is discussed on JIT. So on the JIT, it is decreasing mobility, decreasing secretions, and there is another drug which is L-hyoscine, which is also reducing the mortality in GIT. But we discuss this drug separately. Now only focus on the atropine. The next action of atropine is that it is on the heart. So on the heart, as you are in the fight and flight mode, so actually it has to increase the heart rate, but it is dose dependent. So when it has low dose, its action is something else, and when it is in high dose, its action is something else. So whenever it is in low dose, it's slightly decrease your heart rate, but when it is in high dose, it increases your heart rate. So this is the action of atropine on our heart. Last action of atropine is on our some glands. We have mainly three kinds of glands in our body. Three kinds of glands. First is lacrimal, which is producing tears in our eye. Second is salivary gland, which is producing saliva. And third is sweat gland, which is producing our sweat. So what action is of atropine on these glands? Atropine decrease their secretion. Atropine decrease the secretion of lacrimal. Atropine decrease the secretion of saliva. Atropine decrease the secretion of sweat. So therefore it is causing dryness on your mouth. Okay. Now let's discuss about their use. That your atropine is also acting as an antidote, but it is acting as antidote for cholinergic agonist drugs. So whenever the cholinergic activity increases, then and whenever the toxicity occurs of cholinergic agonist drugs, then you can give antidote of atropine. Okay, and if the toxicity of atropines occur, then you can give an antidote of cholinergic agonist drug. And the most famous cholinergic agonist drug is physostigmine, okay, which is the indirecting and the reversible indirecting cholinergic agonist drug. So this was all about the action of atropine. Now let's discuss about their disadvantage or adverse effect. So first of all, the main adverse effect is that because it is decreasing the secretion, so therefore it is cause a dryness of your mouth and your whole body, cause a dryness on it. Second thing, it is causing trachycardia. ट्रैकी ट्रैकीकार्डिया की स्पेलिंग आप लोग खुद देख लीजिएगा, टी आर नहीं आता, टैकी कार्डिया, ठीक है. And also causing urinary retention because it doesn't allow your urinary bladder to contract and pass the urine out. And these are some kind of adverse effect by the atropine. Now our second drug is scopolamine. Okay, we have discussed all thing about the atropine. Let's discuss the other drug. So the other drugs have same action as the atropine, just they have a little a specific type of reaction which we will discuss. So scopolamine. So this drug is very special because it is the long acting muscarinic antagonist. So L for long acting muscarinic antagonist. So it is long and more, its effect is more prolonged than the atropine. So this is one thing. And second thing is that it also obtained, what is the source of it? So it is obtained from a plant, and it is also a plant alkaloid. It is what? A plant alkaloid, just like atropine, which is the alkaloid present in the Atropa belladonna plant. Okay, what is the action of this scopolamine? So the most major action of scopolamine is to treat our motion sickness. Okay, so it is treating it, but you can say its adverse effect is just similar to atropine. Just its adverse effect is that it can cause sedatives. Sedatives mean induce the sleep, and it can cause the drug dependence, mean it is causing the patient to be euphoric. What? Euphoria. The word euphoria mean it make the patient happy and make the patient to depend on that drug. Okay, so it will urge a patient to take this drug daily in order to make him or his happy. So this is that because it is producing excitement in the patient, so therefore we use the word euphoria in order to say this. Okay, then and its pharmacokinetics is that it has long half life. So what is its pharmacokinetics? So it has long or high half life, and its adverse effect is just similar to the atropine. Okay, now let's move on to the next drug. So on the next drug we have four major drugs which will be discussed here. So the first drug is ipratropium, then there is glycopyrrolate, then there is acylD, इसके स्पेलिंग मुझे थोड़े से गलत लग रहे हैं. Then there is tiotropium. So these are the drugs which are used in order to treat a disease. Okay, so here is the ipratropium. This is the short acting drugs. This is short acting muscarinic antagonist, while all of these three drugs are long acting muscarinic antagonist. Okay, so only one ipratropium is short acting while three are long acting. And what is the role of these four drugs? So they are treating two diseases. Their action is on two diseases. First is asthma and second is COPD. What is COPD? C means chronic obstructive pulmonary disease. So how they are helping to treat the asthma and chronic obstructive pulmonary disease? So what is the mechanism of their action? So mechanism is that these drugs act on beta 2 receptors. So beta 2 receptor will be discussed in the adrenergic part of your chapter. So if you don't listen to this video, then go and visit my channel and see this video. So the beta 2 receptors, the receptors are present on the lungs, in the lungs bronchi. So actually these drugs bind here and produce vasodilation. So actually what happens in the asthma patient? So this is the bronchiole. Let's pause. So in the asthma patient, what is happen? This bronchiole constrict. So due to this constriction of this bronchiole, the asthma occurs. Now in order to treat this asthma, we want to increase the diameter of your bronchiole. We want to dilate this bronchiole. So therefore we will give ipratropium to that patient. What we'll do, we have a specific receptor which is present on the smooth muscle of bronchiole, which is M3 receptors. So what will happen? This ipratropium will bind to this receptor and cause vasodilation of your bronchiole, means that it will increase the size of your bronchiole like that. So now you have seen that how the size of your bronchiole increases. So this was the whole concept which I want to tell to you. Now there are other pairs of two drugs which are used in further reactions. Now the next two drugs which are written are cyclopentonate and uh, and it is tropicamide, ट्रोफी अमाइड. ठीक है, ट्रोफी मिली है अमाइड को, और साइक्लोपेंटोनेट. ठीक है, सो ये ड्रग्स पेंटोनेट नहीं है, पेंटोलेट है. पेंटो साइकिल पे आया हमारा पेन और वो लेट हो गया. ठीक है, साइक्लोपेंटोलेट, साइकिल पे आया हमारा पेन और वो लेट हो गया. और ट्रॉफी उठाई किसने? अमाइड ने. ये दो तरीका है इनको याद रखने का. इनको याद रखना है कि ये एट्रोपिन के साथ ही यूज़ होते हैं ऑप्थेल्मिक सोल्यूशन में. ऑप्थेल्मिक सॉल्यूशंस आर यूज इन द आइस. ओके, सो सो ये आइज़ के सॉल्यूशंस में यूज़ होते हैं, आई ड्रॉप्स के लिए यूज़ होते हैं. सो व्हाट इज़ देयर एक्शन? सो दे आर हेल्पिंग इन डायलेशन ऑफ pupil, मीन्स इन द midriasis. Okay. So, but the difference between the atropine and cyclopentolate and tropicamide is that both of these drugs are short acting. They are short acting muscarinic antagonists, while the atropine was the long acting anti muscarinic drug. Okay? So, this was the difference between these two drugs. Now, let's discuss other two drugs which are used, and they are the anti Parkinson drugs. First drug is benzotropine. Other drug is trihexyphenidyl. ठीक है, ट्राईहेक्सीफिनाइलडाइल और बेंजोट्रोपिन. ठीक है, these two drugs are anti-Parkinson, so it is treating Parkinson disease. Okay, now the last drug which is written in your book is the oxybutyrin and some other anti-muscarinic agents. So next drug is oxybutynine and सोली एंड डरी. ठीक है, देन सोली, आगे फेनाइसिन, इसमें भी फेनाइसिन आ जाएगा. ठीक है, ये मैं साथ साथ इसको याद करने का भी तरीका आपको बताती जा रही हूँ. ठीक है, उसके अलावा अगर हम लोग बात करते हैं ड्रग की, तो हमारे पास TRO होता है, प्रोस्पियम. ठीक है, ऑक्सीब्यूटानिन, प्रोस्पियम, ये दोनों तो आसान है, आप याद कर लेंगे. बाकी तो याद करने का तरीका यह है, सोली और डरी, आगे फेनेंसिन, दोनों में सेम आएगा. नाउ दीज ड्रग, व्हाट आर द एक्शन ऑफ दीज ड्रग? सो एक्चुअली दे आर एट्रोपिन लाइक ड्रग, बट दे आर ट्रीटिंग द ओवर एक्टिव ब्लैडर. ओवर, so the person who in which the urinary bladder is too much active and they have too much urine energy, so therefore overactive urinary ब्लैडर को ट्रीट करते हैं. सो कैसे इफ़ेक्ट करेंगे, इनका मैकेनिज्म ऑफ एक्शन क्या है? क्योंकि आपकी यूरिनरी ब्लैडर के ऊपर मस्करानिक M3 रिसेप्टर्स होते हैं, उनके स्मूथ मसल्स के ऊपर, जिसकी वजह से ये उनके ऊपर जाके बाइंड करते हैं और उनको इतना ज़्यादा कॉन्ट्रैक्शन उनमें नहीं होने देते, यूरिनरी अनकॉन्शियस नहीं होने देते, ओवर एक्टिव ब्लैडर को ट्रीट करते हैं. दूसरी चीज़ ये है कि इनकी हाफ लाइफ भी लॉन्ग है, इसलिए आपको इसके ज़्यादा डोज भी नहीं लेनी पड़ती. लेकिन इसके कुछ एडवर्स इफ़ेक्ट भी हैं. एक तो ये है कि आपकी ड्राइनेस ये काज कर देता है आपकी बॉडी के अंदर. दूसरी चीज़ ये आ जाती है कॉन्स्टिपेशन और ब्लरी विजन. ठीक है, तो कॉन्स्टिपेशन को ये ट्रीट कर रहे हैं, ओके हो गया. और इसके अलावा ब्लरिड विजन, ये इनके कुछ एडवर्स इफ़ेक्ट आ जाते हैं जो ऑक्सीब्यूटानिन और इन ड्रग्स की वजह से होते हैं. ठीक है, सो लास्ट ड्रग जो आपके इस चैप्टर के अंदर इंक्लूड है, वो हमारे पास एल हायोसिमाइन की ड्रग है. एल हायो, ठीक है, मैं स्पेलिंग देख लूँ एल हायोसिमाइन के. सो हायो में यहाँ पर एस नहीं आना है, पहले ओ आना है, फिर SCYAMINE. सो अमाइन, हायो, स्काई, अमाइन. ठीक है, ये ड्रग भी एट्रोपिन की तरह ही JIT की मोटेलिटी को कम करती है. सो एंटी प्लाज्मोडिक वर्ड यूज़ किया गया है इसके लिए. तो एंटी प्लाज्मोडिक ना कोई भी चीज़ नहीं है, जस्ट यही है कि JIT की मोटेलिटी को कम कर रहा है. ठीक है, इसका और कोई मतलब नहीं है. ठीक है, सो ये हमारी सारी ड्रग्स हो चुकी हैं. हमने देखी हैं कौन सी कोलिनर्जिक एंटागोनिस्ट ड्रग्स हैं. तो ये तो वो ड्रग्स हैं ना जो मस्करैनिक रिसेप्टर को ब्लॉक करती हैं. ठीक है, सो अब हम लोगों ने नेक्स्ट पार्ट में पढ़ेंगे कि कौन सी ड्रग्स हैं जो गैंग्लियोनिक ब्लॉकर्स हैं, और फिर उसके बाद हम न्यूरोमस्कुलर ब्लॉकर्स देखेंगे, और फिर हमारा चैप्टर यहाँ पर एंड होगा. सो आई होप कि आप लोगों को आज का वीडियो अच्छी लगी होगी. और आप वीडियो अच्छी लगी है तो प्लीज़ वीडियो को लाइक कर लें, अपने फ्रेंड के साथ को शेयर करें, चैनल को ज़रूर सब्सक्राइब करें और बेल आइकन प्रेस करें ताकि आने वाली हर नई वीडियो आप तक पहुँच सके. सो टेक केयर ऑफ़ योर सेल्फ. मिलेंगे नेक्स्ट लेक्चर में, तब तक के लिए अपना बहुत सारा ख्याल रखिएगा. अल्लाह हाफिज़.